Demonstrate the universal curette today. First of all, we need to determine which end of the instrument to use. So if I were to just lay this instrument against the tooth, I know that my tip should be turning towards the tooth, so I know already I've got the wrong end. If I were to try an instrument, let's say I rotated it in my hand like this, I still have my terminal shank that is laying along the side of the tooth, and our terminal shank, if it's oriented correctly, needs to be parallel to the long axis. So I've flipped the end, and then I'm turning the toe this way, and the terminal shank then should go up and over the occlusal surface if I have the right end. Okay, so Bree, you can go ahead and say, I'm having to look in the video to see what I'm doing here.
So
okay?
First we prepare me, my patient, my light, my dominant hand, my non-dominant hand.
So my non-dominant hand will be in the modified pen grasp, and it's not going to be in the view. But normally I would be retracting the cheek, but we're going to move that out of the way for better viewing. So I'm in the modified pen grasp with my non-dominant. I have a modified pen grasp with my dominant hand. My terminal shank's parallel. I'm sitting at 9 o'clock. The patient's turned slightly away from me.
So number 2, you're going to establish a finger rest. Keep your fulcrum finger out of the line of fire by establishing a rest near, but not directly over the surface to be instrumented.
So if I am going to instrument number 31, the second molar, I'm fulcruming across the occlusal and lingual of the premolar area. Okay?
Number 3, get ready. Turn the toe of the working end toward the distal surface. Place the working end in the get ready zone in the middle third of the crown. In this case, the get ready zone is at the distofacial line angle in the middle of the third crown. Or middle third of the crown. Okay, number 4, begin with the first molar. As an introduction to the universal curette, first practice on the mandibular right first molar. The distal surface is completed first, beginning at the distofacial line angle and working onto the distal surface. 5.
Okay, so one thing to remember, as we orient the instrument, we want to close the blade. So we're going to have, in order to do that, we're going to have to bring the handle down in order to close the face into the pocket. So we're going to close it by dropping the handle down like this. And then, once we're subgingival, then we would come up on the instrument. Okay, go ahead.
Number 5, lower the handle and insert.
Okay, which we just did.
Lower the instrument handle and establish a 0-degree angulation. Gently slide the working end beneath the gingival margin and onto the distal surface of the root.
Continue.
6, establish angulation and lock toe third. Establish an 80-degree face-to-root surface angulation by tilting the lower shank slightly toward the distal surface. Adapt the toe third of the working end to the distal surface of the root. Imagine locking the toe third against the tooth surface.
Okay, so if this is the distal, I've inserted handle dropping down so the face is closed. I've inserted subgingivally, and then I'm not going to be at 90. The face is at 90 here. Can you see on my fingernail? Mm-hmm. So we want to take the face and the subgingival. We start at 0 and then open to about 80 right there. And then our toe third is going to, see how it's grabbing my fingernail. That's what we want it to do, to grab the tooth. If I'm at 90, I'm going to cause tissue trauma. Okay, continue, Bree.
Number 7, technique check. It says this photograph shows an aerial view looking down at the occlusal surface. The curette's face should be at a 70 to 80-degree angulation to the distal surface.
Okay, and we just covered that. Okay.
To obtain this angulation, the lower shank will be tilted toward the distal surface.
Like so. Okay, continue.
Instrumentation of the facial surface. You are now ready to instrument the facial and mesial surfaces of the tooth, beginning at the distofacial line angle.
Okay, so I'm going to do our rock, just like we did with our Explorer, to do the distal. And then as I come around the distal like this, then we're going to come up with my thumb. I'm going to roll the instrument handle. Now the toe is going to head towards the anterior part of the mouth. Okay, continue, Bree.
As you just said, get ready for the facial aspect. Turn the working end so that the toe of the curette is pointing toward the front of the mouth. Place the working end in the get ready zone on the middle third of the facial surface near the line angle.
Well, here's our get ready zone. Reinserting at 0, opening up to about 70 to 80, and I'm doing an oblique. This is real important not to get that blade because a universal has 2 cutting edges. So this blade here is not impinging on the pocket wall. So the other thing that's in your book it talked about was that you have to remember that when we're doing the distal, this side of the instrument is engaged on the tooth surface. But when we move to the direct facial surface, now as we roll that tip, the other side of the blade now becomes engaged. So we use both sides of this instrument as we walk from distal to distal facial line angle and across the facial. And then that same, go ahead, Bree, keep reading.
Gently slide the working end beneath the gingival margin. Imagine the face sliding along the facial surface all the way to the base of the pocket.
That. At 0 degrees. Okay, go ahead.
As you approach the mesiofacial line angle, roll the handle slightly to maintain adaptation.
So right here we're going to roll. I'm getting a little hyperextended there, so I'm going to readjust the grasp.
Keep the toe third locked against the tooth surface.
So again, I'm going to use my finger in a second here for you to see. If this were the mesial surface, again, as I come around that line angle, I want to keep that toe engaged. If I'm in the middle third, my tip is rolling out, I still will have some action, but it's not going to be as effective as if I'm on the toe third, like that. Was there any other?
Yes, there's 2 more.
Okay.
Technique check. Make sure that your strokes extend past the midline of the mesial, aka 51%. Work at least halfway across the mesial surface from the facial aspect while maintaining proper angulation. The other half of the mesial surface will be instrumented from the lingual aspect.
Great.